Good afternoon, everyone. My name is Jeff Klein, President of the Washington County Commissioners. The purpose of this press conference is to provide information on local government, Washington County's proactive response to the rapidly evolving coronavirus situation. At this time, there are 38 coronavirus cases in Maryland, including one case in neighboring Frederick County, which was announced earlier today. This morning, the governor issued an executive order further limiting social interaction to minimize community spread of coronavirus. State and local agencies and area businesses are making operational changes to address the public health issue. In light of the above, and knowing that it is only a matter of time until coronavirus is confirmed in Washington County, the Board of County Commissioners and I have declared a local state of emergency effective immediately. This declaration will allow for greater coordination between government, healthcare providers, and public safety personnel as they address the COVID-19. It is no cause for panic, not to be alarmed. Stay calm. Washington County government is providing the precautions and necessary preparations to protect our community. Thank you. I will now turn the press conference over to Earl Stoner, Washington County Health Officer.
Thank you, Commissioner. I just wanted to take a few moments to reiterate what the Commission President just said, and that it's no time to panic. It's certainly, we are seeing community spread throughout Maryland. We have no cases and confirmed cases in Washington County, but we are preparing, and we have been preparing for weeks for that eventuality. One of the biggest things that we can do at this point, and we're seeing it from the federal level down through the state level and now on the local level, is to social distance. I know that a lot of people out there have probably heard the hashtag flatten the curve, but it literally is that. It is a situation where we have to distance ourselves from one another. The governor has enacted fairly stringent, and CDC has enacted fairly stringent guidelines. We are 50 people or under as far as gatherings. People have to take this seriously. I know a lot of individuals out there here, well, it's mild, a lot of people aren't getting it, young people aren't getting it, but the point of social distancing is exactly that. This is a disease that could be asymptomatic, especially in young individuals. And even though individuals are not sick, they still could be spreading the disease. They still could be spreading the virus. So it is critically important that we limit our social interactions, that we adhere to the recommendations and the executive orders that are coming out. It is absolutely critical. We have to think about this in the lens of the individuals who may not get it or who may have mild disease are doing what they can do to protect the most vulnerable populations, the elderly, individuals with underlying health conditions, immunocompromised individuals. It is critical that we, as a society, as a county, adhere to the recommendations that are coming out for social distancing. The two premises of flattening the curve are to avoid the spread of the disease and to really look at it from the scope of a hospital or healthcare situation, where if we do not social distance and we are transmitting the virus freely between one another, rapidly transmitting it to one another, regardless of whether we're sick or not, we are going to experience a crush in potential inpatient care, a crush to the emergency system, to the EMS system, which will be debilitating, even with the robust plans that we have as a country, as a state, and as a local community. So it is critically important that we practice social distancing, that we take social distancing very seriously, and that we flatten that curve, that we don't see the tremendous peak as you're seeing in the diagram now, that we lower that from a peak almost to a mound, and that gives the hospital surge capacity, much more effective and efficient response, EMS much more effective and efficient response, and we will see the potential fatality rate lower as opposed to not doing anything. And we see a tremendous peak, and we see significant fatalities and significant comorbidities that come from this. So the take-home message is we don't have any cases, confirmed cases in Washington County. Now is not the time to panic. We need to continue to prepare, and we need to take social distancing and the measures that the governor and that the federal government are enacting very, very seriously. With that, I will turn it over to Kirk Downey, Interim County Administrator and County Attorney.
Thank you, Earl. Good afternoon. I want to provide you with some information regarding the steps county government is taking to attempt to flatten the curve that Earl spoke about to lower and delay the peak of the epidemic in Washington County. First, to allow additional time to prepare for and respond to this rapidly evolving situation, tomorrow's Board of County Commissioners meeting is canceled. Going forward, the board's meeting schedule will be assessed on a week-by-week basis or more frequently if necessary. The Board of County Commissioners is fully engaged in the response to this pandemic and will take actions as necessary to robustly address public health concerns. Second, with actions being taken by state, county, and municipal governments across Maryland, public access to county buildings is restricted as follows. The general public will be allowed in county offices by appointment for essential business only. That means that unless a matter is time-sensitive, legally required, or non-discretionary, an appointment will not be scheduled. We appreciate the public's assistance and understanding during this health crisis and ask that only essential matters be addressed for the safety of the public and county staff. The Treasurer's Office and the Board of Elections are also operating by appointment only. Visitors to county buildings will be asked a series of screening questions to assure compliance with this directive. The public is reminded that, pursuant to the governor's order, the Commission on Aging remains closed. County parks will remain accessible to the public, but programs sponsored by Washington County Parks and Recreation are canceled. Black Rock Golf Course remains open except for its restaurant. Third, the county encourages its employees to telework from home if they can and if their departmental supervisor allows. For those employees who must work on site, the county is providing additional daily opportunities for disinfecting employee workspaces. Employees are encouraged to continue practicing social distancing and frequent hand washing. Finally, those employees who are sick or are exhibiting symptoms of COVID-19 should stay home. Employees who report to work sick will be sent home. Finally, please help us to protect the health of Washington County residents. The effects of COVID-19 could be severe, even fatal, especially for our vulnerable populations. While there are currently no confirmed cases in Washington County, this virus is likely already in our community. Accordingly, please heed the health directives that you have been hearing. Wash hands frequently, limit social interaction, and cooperate with governmental authorities. Compliance with governmental efforts to mitigate the severity of this pandemic is everyone's civic responsibility. Thank you for your attention and cooperation. We're free to answer any questions that you may have. In tangible terms, it allows for greater authority over governmental and community response to the matter. It also provides additional sources of funding given what other federal and state governments may take in response to the crisis. I'll defer to Dave or to our emergency planner, Tom, if they'd like to provide some further information.
So as the administrator alluded to, specifically to emergency management, the state of emergency will allow emergency management to assume more of a coordination and support role secondary to the health department, who remains the lead agency. Prior to that state of emergency, most of those things are participatory, and while we're having great participation from our partner agencies, we want to make sure as this thing continues to evolve that we're in front of it and have the ability and the authorities to make decisions at a county level rather than each individual entity making their independent decisions.
I direct you to the governor's office for those types of questions, but the governor's order makes clear that noncompliance with the executive order is a misdemeanor and it is punishable by fine or imprisonment. And all local and state law enforcement personnel are empowered to direct and enforce the order. I have not heard anything. You're welcome. Well, as you know, if you follow the news, Congress has passed a measure providing additional funding and resources to citizens and governments to address this matter. The state has also passed a measure providing for additional resources to allow the governor to address the matter. We think eventually some of these resources will flow directly to those businesses that have been impacted um, by this matter, but that's still being figured out and implemented. Thank you.
I I can't speak to the county's plan per se, but I can say that the expectation from viral spread winding down and from a true public health threat, I think that we don't necessarily need to be looking at this as weeks but months.
Anything else? Thank you very much, and please take the appropriate steps to stay healthy.